Hi, my name is Annie, and I'm one of the product managers at Chiron, and I've been with the company for 4 years now, and I've been heavily involved in the development of Mia. So I'm really proud and excited to be able to share this product with you today. So let's get started. Chiron Medical Technologies is a leading applied science company transforming cancer diagnostics through the power of deep learning. We are starting with breast cancer, and our award-winning AI breast screening solution is called Mia. MIA, which stands for Mammography Intelligent Assessment, is our suite of AI solutions for breast cancer screening. MIA is designed to empower radiologists and screening services to deliver confident, accurate, and timely results to any woman anywhere. In this presentation, we will be focusing on the original solution in the MIA family, MIA as a reading solution for screening mammograms. Patient and public involvement sits at the heart of everything we do at Chiron. The image you see on your screen is of my colleague and friend, Mary Beth. Late in 2019, she was diagnosed with stage 1 invasive ductal carcinoma after a routine mammogram. From screening to the completion of her irradiation, her cancer journey was 60 days. Her story is a reminder to all of us here at Chiron of why we do what we do, so that cancers can be detected at an early stage. We have worked very closely with Mary Beth and other women who have experienced firsthand the impact of breast cancer to make sure we understand the entire patient pathway and what really matters to women. We also work hard to understand what matters to radiologists and technologists. We want to develop technology that improves operational, clinical, and economical outcomes by tackling the key challenges that breast screening programs currently face. Before we developed our technology, we talked to breast radiologists from around the world to understand their key challenges. The feedback revealed that for the majority of screening programs, the main concerns are the lack of consistent and standardized performance, missed cancers and high recall rates, which also bring additional costs, a growing shortage of breast radiologists in many countries, and the limitations of existing CAD systems. Clinical rigor is at the core of everything we do. Partnerships are key in our progress to date, helping us to validate and deploy MIA safely into clinical practice. We have recently collaborated with several UK National Health Service sites on one of the largest AI studies ever conducted. We are also very privileged to work with LRCB, the Dutch Expert Center for Breast Screening, who oversee one of the most respected screening programs in the world. And in North America, we're also working hard on generalizability to make sure MIA works for any woman anywhere. Our key partners here include Emory University and the University of California, San Francisco. These partners enable us to evaluate MIA's performance on some of the most diverse multi-ethnic screening populations in the US. With our clinically rigorous studies in the UK, Europe, and the United States, we are committed to going beyond what current regulations require to prove that MIA is the best performing software and is safe for all women receiving mammograms. The results from our first study can be seen on your screens. This study was run in 2018 on a single European population from 4 sites and a single type of hardware. MIA's performance in the study was 90% sensitivity and 89% specificity. These results mean that MIA can detect breast cancer as accurately as experienced fellowship-trained breast radiologists in the US. Our commitment to safe, generalizable AI led us to design our second clinical study, which we just recently completed. This groundbreaking study of MIA's performance was conducted across multiple sites, countries, and mammography devices with more than 250,000 cases from real-world screening populations, making it one of the most ambitious studies in radiology AI to date. This trial showed a level of performance that strongly indicates practical utility and a level of generalizability that strongly indicates safety. This implies that with MIA, the standard of care can be maintained or may even be improved even in the gold standard double reading setting. And finally, our focus on clinical rigor has recently been validated by the UK government, who selected Karan as one of the first winners of the AI in Health and Care Awards. This award will accelerate the rollout and rapid adoption of MIA to address critical challenges in breast screening services in the UK and beyond. It will also enable us to replicate and accelerate our rigorous approach to clinical validation, which will have a positive implication not only on the NHS, but also on providers in other countries. Lastly, this important AI award will allow us to generate clinical and health economic evidence, enabling us to demonstrate how AI can improve the standard of care for any woman anywhere in the world. In summary, MIA has been developed to empower radiologists by reducing missed cancers, lowering false positives, and increasing productivity. MIA supports providers by delivering immediate cost savings, increasing standardization, and mitigating radiologist shortages. And MIA improves the patient experience by providing reliable cancer detection, reducing recalls and anxiety, and avoiding unnecessary biopsies. I hope this presentation has shown you that when modern AI technology is applied with deep clinical rigor, it can create the optimal human-computer partnership to produce excellence in breast cancer screening programs. Thanks for your time.